and the Metro Coronavirus Task Force. Also joining us today are Ian Ayre, CEO of Nashville SC, Burke Nihill, President and CEO of the Tennessee Titans, and Senator Bill Frist, Chairman of Nashville Health, who is joining us by WebEx video conference. Also here today are Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of Public Health, who are here to help answer your questions. We'll now begin with Mayor John Cooper.
Good morning, Nashville. 100 years ago today, Tennessee became the 36th and final state to ratify the 19th Amendment, 100 years ago today, legalizing the women's right to vote in the United States. In the summer of 1920, the fierce political battle between opposing factions of the ratification debate would become known as the War of the Roses, with suffragists having yellow roses and their opponents red roses. Nashville was the final and most important battleground for the ratification of women's suffrage a century ago. And their victory is a jewel in Nashville's own legacy of important social change. Now today, as we celebrate the strength and conviction of suffragist leaders in our past, I hope you will join me in honoring their legacy in Nashville of fighting for equality and justice for everyone. Now this morning, Metro Public Health is reporting 126 new cases of COVID-19. Since our last press briefing on Thursday, Nashville's 14-day new case rolling average is essentially the same at an average of 189.7. This metric remains in the green. We're currently at 27.1 per 100,000 residents for our 7-day new case average, down from 28.5 on Thursday. Once again, anything over 10 per 100,000 residents exceeds a widely adopted national standard for a dangerously high virus outbreak level, including Tennessee's own state standard. Nashville's transmission rate has risen from 0.83 to 0.87, and our 7-day positivity rate has declined since Thursday from 13% to 12.2%. Dr. Jahangir will review our COVID-19 metrics in more detail momentarily. Now, across the United States, there's a wide range of approaches to in-person attendance for professional sports, based on a wide range of public health policies and the prevalence of the coronavirus in those locations. We cannot waive our public health principles no matter how much we are rooting for our home teams. We must take a cautious approach, recognizing that we cannot predict our COVID-19 metrics further into the fall sports season. Our COVID-19 metrics further into the fall sports season. Now, I'm grateful both to the Tennessee Titans and Nashville SC for working closely with our office and the Metro Public Health Department while prioritizing the safety of their players, staff, and our residents. The Tennessee Titans and Nashville SC will begin their fall seasons without in-person attendance at Nissan Stadium for at least the months of August and September. Our current disease level requires our teams to begin their seasons without spectators. We may ease these restrictions based on improved COVID-19 numbers and the experiences of other NFL and MLS cities. In Nashville, we have 3 times the disease level that restricts travel in the United States. We cannot add any risk from potential super spreader events. Now, this morning, it's my pleasure to welcome Ian Ayre, CEO of Nashville SC, and Burke Nihill, President and CEO of the Tennessee Titans, who will provide more details on the arrangements they've made to begin their season safely. Now, in professional sports, as in a pandemic response, you cannot assume progress. It must be earned. You have to deal with the reality of what the score is and what you have to do to win. Now, each day, each moment brings a new opportunity for Nashvillians to step up, to make the play, and to do what's right, and reclaim the health and well-being of our community. Winning teams get the fundamentals right, and for us, that's wear a mask and socially distance. Now, I also want to welcome Senator Bill Frist, Chairman of Nashville Health, who's joining us by video conference to introduce the launch of a new community-wide campaign encouraging all Nashvillians to wear a mask or other face coverings in public places. I'm also grateful for Senator Frist's leadership in the COVID-19 Response Fund and his ongoing efforts to strengthen our nation's pandemic response. Remember, Nashville, don't share your air. Remember to mask up in public places and stay socially distanced from others. And now I'll turn it over to Dr. Alice Shahanger, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here's an update on some additional metrics. Our hospitalization rate continues to be stable, if not improving. Last Friday, 155 people in Nashville area hospitals were hospitalized with COVID-19. That is down from 176 the previous Friday and 222 just 3 weeks ago. To give you another perspective, if you looked at the percentage of people admitted in our hospitals with COVID-19 compared to all the people admitted in Davidson County hospitals, last week, 9.3% of all admissions were because of COVID-19. Just 3 weeks prior, 13.8% of all admissions were COVID-19 related. Today, we are reporting 6 additional deaths as a result of confirmed cases of COVID-19. This brings the total confirmed deaths to 212 individuals. From the start of this pandemic, we have emphasized that the virus affects the elderly and those more vulnerable the hardest. And the numbers we have seen thus far in Nashville back that up. All 6 of the confirmed deaths reported today are from people over the age of 90, and all 6 of those individuals had underlying medical conditions. The mortality rate for the city remains low at 0.9%. This changes drastically when you look at the older population. In fact, in our city, people ages 75 years or older who get this disease have a mortality rate, or the death rate, of 13%. That's nearly 15 times more than the average mortality rate in Nashville. And we have said, and our numbers are showing, that younger people who get the virus fare much better. The mortality rate of ages 35 to 44 is 0.1%, or 9 times better than the city average. Those under 45 make up the most cases, 71%, but only account for 2.8% of all deaths because of COVID. Now, our data confirms that if infected, younger people's morbidity and mortality is less than elderly and the more medically vulnerable. So, if you're under age 45 like I am, then please listen. Or, if you know someone that's under age 45, please pass on the word. Our age group has the most number of cases, and so our age group has the biggest opportunity to spread this virus. Please wear a mask, socially distance yourself, and don't go out to parties. Be smart. Yes, if you get the virus, you probably will be better off and you'll probably do okay. But if you can pass it on to someone who's older, or you pass it on to someone who then passes it on to someone that's older, then you will hurt that person, and you may end up resulting in the death of someone close to you. We all want to get back to where we were before the pandemic, enjoying a night out with a bunch of friends, getting our kids out of the house and back into school, or going to a Nissan Stadium to cheer on the Titans or Nashville SC. But to get there, we need to continue to fight this virus more. Over the last couple of weeks, our key metrics are trending well and have stabilized, and that's really encouraging. However, we do need to see a little bit more improvement so we can continue to reopen our city. Now, a quick reminder that our 3 community assessment centers are open today until 1 p.m., and they're open every day, Monday through Friday, from 7 a.m. to 1 p.m. The tests are free, and on average, you'll get your results back within 3 days. I really appreciate what everyone's doing, and please encourage your friends and neighbors to do the same. I now would like to introduce Mr. Ian Ayer of Nashville SC. Thank you.
Good morning, Nashville, and good morning, Nashville SC fans. It's hard to imagine that it's almost 6 months since we played our inaugural game at Nissan Stadium here in Nashville on February 29th, when 60,000 people came out for that game. It's even more hard to imagine just how the world has changed since that game. And as we approach our return to play here in Nashville on August 30th, it's impossible to think that we could bring people to this opportunity. What's really important for us now is to make sure we're safe and protective of our fans and all of Nashville. Nothing we would like more than to have our fans at a game, but we really want to protect everybody's safety. So that's about paying attention to the protocols of Metro Public Health, the CDC and other guidelines, and making sure that we do the right thing and play our part as a soccer club and as fans and supporters. And hope that by doing that, at some time in the future, we can bring you back to games and support our boys in goal going forward. We thank you for your continued support, and we look forward to seeing you at a game soon. Thank you.
Thank you, Mr. Ayer. We'll now turn it over to Mr. Burke Nihill of the Tennessee Titans.
Thank you, Mayor Cooper, for inviting us to be here with you today. Before I say anything else, I'd like to mention that we at the Tennessee Titans are thinking of everyone impacted by the effects of the COVID-19 virus, as well as our healthcare workers who are working tirelessly to help us get through this pandemic. There's certainly no denying that we wish we would be opening our home schedule on September 20th in front of fans. Professional football is a game meant to be played in front of a loud, cheering crowd, and no one desires that outcome more than us. However, these are not normal times, and as civic leaders in this great city, we understand and support Mayor Cooper and Metro Nashville Public Health Department's decision today to delay welcoming fans into Nissan Stadium. Over the past many months, we have partnered with the city and the world's foremost health experts to build a safety plan to get fans back to Nissan Stadium. We are all confident that the Safe Stadium plan we built together is an extremely thorough, comprehensive plan that is ready to implement as soon as the time is right. We can't thank Dr. Caldwell, the health department staff, and the mayor's office enough for their collaboration and support of our Safe Stadium plan. I'd like to take a moment to speak to Titans fans all across our region. Titans fans, we need you to be diligent about limiting the spread of this deadly virus. We need you to wear a mask and encourage your friends and family to wear masks so we can welcome fans back to Nissan Stadium soon. In the coming weeks, we will partner with the city to communicate the safety messages necessary to continue the progress Nashville is making in its battle against the COVID-19 virus. We need to keep moving the chains, Nashville, and I know Titans fans can help lead the way. I can assure you of this. This virus will not deter us from our mission to bring you an exciting, competitive season of Titans football. We hope our fans can cheer us on at Nissan Stadium soon. But in the meantime, look forward to feeling everyone's support and energy from home as we kick off the season with Monday Night Football on September 14th. Thank you.
Thank you, Mr. Nihill. I'd now like to introduce Senator Bill Frist, who is joining us live by WebEx video conference. Senator Frist.
Thank you, Mayor Cooper and Dr. Jahanger, and thank you to Nashville, the frontline workers, healthcare heroes, the school teachers and administrators and business owners who are working every day toward a return to normalcy of some type, all the while being still safe. As a native Nashvilleian and a doctor here, I love my hometown and I care about the health of my fellow Nashvilleians. That's why we created the organization Nashville Health. And that's why Nashville Health and I are asking you to mask for Nash. There's no question that the best shot we have to reopen our city and to get back to school and to enjoy the activities we've all so badly missed today, absent a vaccine, is to use a mask or a face covering. We're at a critical time, and some have called it fragile progress, and I agree, but we are making strides to flatten the curve. I am asking you to not let your guard down. I'm asking you to mask for Nash. In addition to washing your hands and keeping your distance and limiting social gatherings, please mask for Nash. Nashville Health is excited to join with community partners from businesses to nonprofits to community organizations to launch this campaign. #MaskForNash. for Nash, and we want you to do so as well. Please join us. You can visit NashvilleHealth.org for more details about the Mask for Nash campaign. And please share this message with your friends and families and neighbors. Let's do this well. Let's get our kids back to school and our restaurants open responsibly and some semblance of normal life in place for the rest of these years. I am grateful, alongside these city leaders, for your sacrifices, your hard work, and your perseverance. Let's all mask for Nash. Thank you.
Thank you, Senator Frist. We'll now begin taking media questions. We'll start with Stephen Elliott at the Nashville scene. Stephen?
Hey, thank you. Last week at the state legislature, as they were considering the camping and vandalism bill, supporters repeatedly invoked Nashville's name and referenced events that took place in Nashville, including on city property. And so, because Nashville was used as the reason for that bill, Mayor Cooper, do you support it? Do you have any thoughts on the new penalties included in it?
Mayor Cooper.
Well, thank you, Stephen, for that question. Today of all days, where we're celebrating the extension of rights, I'm really think all of us in Nashville agree we need to protect people's rights, and we don't want to do anything that seems to restrict people's rights, including rights to make their political views known. And I hope that is not the consequence of this bill that was passed by the legislature.
Julia Palazzo at WKRN. You're on the air.
Hi. Good morning, all. Thank you so much. Mayor Cooper, 2 questions. The new guidelines meant to help bar owners, the 25-person limit. Some people have told us that they can't afford to operate with this limited capacity. What's your response to those concerns from them? And what is the likelihood that you would increase that capacity sometime soon? And then either the mayor or Dr. Jahangir could probably answer this, but the decision to not have fans at Nissan Stadium, will we have to reach phase 4 requirements laid out in the initial roadmap to reopening to bring them back, or will it be in a modified phase and just really depending on the metrics at this point? Thank you.
Thank you, Julia. Mayor Cooper.
Thank you, Julia. I'll go first. On the restriction of 25 per person, there's a lot of that. There's a certain amount of fairness. There's a certain amount of honoring how good many establishments are at working through the pandemic. 25 is a very controllable number, however, and it's a start. It's a trial period where we can see how well that is executed. But if we are at 3 times the disease level that restricts our travel in the United States, we have to, we can't relax. Every day as an opportunity for the disease to get ahead of us. Right now we are in a fragile spot, and we're trying to do what we can to navigate the economic dislocation while accepting the minimal amount of public health risk. And again, for all the bar owners who are doing excellent work, having a socially distanced protocol into this, I want to thank them. And let's see how it works with this 25. It should be a group that you can supervise safely. And again, it's a start, but we are so far from being free of this disease. When we're at 28 per 100,000, we're in the top 5 states, we're in the top few cities in the country in our disease spread. We have to take action.
Regarding your question about when crowds can come to the stadiums, I think it is evolving. I wouldn't tie it to a phase per se. I think it evolves on all the metrics. But what I want to say is the leadership of the Titans and Nashville SC, I've had an opportunity to see some of these plans that have been put in place. It's really stellar, and I appreciate their partnership in really looking out for the public health of our city and being leaders in our city And so I know they, like us, want to get everyone back to as close to normal as we can. And when that time comes, I know the plans that will be implemented for public safety will be followed and will be very helpful. So I wouldn't tie it to a phase per se. Just let's see how it evolves over the next few months. Thank you.
Brett Kelman at the Tennessean, you're on the air.
Good morning, everybody. I have a two-part question, one sports-related, one not. First, I'm curious if the mayor and Dr. Jahangir would support similar crowd restrictions at Vanderbilt Stadium, which is scheduled to begin college football games in October. And second, I noticed that yesterday the city reported a dramatic increase in hospitalizations. I believe they dropped by 36, which would be the single biggest swing in Davidson County hospitalizations in one day since the pandemic began. Did something happen, or is that just the natural ebb and flow of people entering and leaving the hospital?
Thanks, Brett. Dr. Jahangir.
So, Brett, in regards to your first question of Vanderbilt Stadium, yes, we're against any large event that may be a super spreading event. I suspect, actually, I know there'll be discussions with them. Again, the leadership that the Titans and Nashville SC have shown as our professional teams here, I think should be an example for all. Regarding the other question around hospital capacity, I looked at some of those numbers today. I think the big thing was, we get our numbers from the state. There are 9 hospitals that report to the state database. When I reviewed that data this morning from last week, a couple of those days, only 7 hospitals had reported, frankly. So I think the reason you probably saw an increase of that large spread was that I don't know which hospitals, because the state database does not allow me that opportunity to see which ones easily. But I suspect maybe it was one of our larger hospitals that reported today. And so I think that's the thing. But the trend is legitimate, that it's heading down. It's hospitalization rates have gone down a good percentage, and hospitals feel less stressed today than they did 3 weeks ago. So I hope that answers your question. Thank you.
Ian Jung at the Tennessean.
Good morning. A question for Mayor Cooper. Will the 40-person Policing Policy Commission have open meetings that will be live streamed to the public? And how involved is the mayor and Chief Drake in the MNPD investigation? And do they think there is a systemic cultural problem as described in the documents by Silent No Longer and other groups in the community? And I don't know if Chief Drake is in the room, but if he is, can you share any specifics on how he plans to recruit more women to the department?
Chief Drake is not here today, so I'll refer your final question to them in PD. Mayor Cooper.
Yes, thank you, Johan. The first on the investigation, that's in the hands of the district attorney. I think both the chief and I felt that it should be there, and we await a very thorough and knowledgeable investigation. The DA's office has developed lots of expertise in the areas of these specific allegations, and I think that's the right place in Nashville to proceed further. On the 40-person commission, I think the first meeting certainly is open. Everybody will be welcome, as it's the organizational meeting that then will determine, I think, the rules going forward. I imagine most all the meetings will be open, but again, we'll know more about that on Wednesday when the convening happens, and I believe there's a presentation by the COB and by the Chief of Police as partners in their work going forward.
Nancy Hammonds, WSMV.
Hi, thank you again for taking questions. I have questions in 3 different areas. First, for the leadership of both teams, can you describe how you're testing your athletes? And can you talk about how the visiting teams will be housed? Will they be in a specific hotel? I have a question also about reusable grocery bags. Some grocery stores allow them and others ban them. Is there a citywide guidance on that? And finally, a question about the fairgrounds. Are you going to continue using of the expo buildings as a homeless shelter into 2021? And what do you see as the future at all of having any events there? Could you have an open air event if you, for example, open the garage doors in the expo building? Thank you.
So your first question about testing and visiting teams, I'll invite Mr. Ayer to come up first, and then you had a follow-up question about reusable shopping bags. I'll direct that to Dr. Caldwell, and then you had a third question about the fairgrounds. Chief or Dr. Jahangir will answer that. Mr. Ayer.
Thank you. So in the case of testing our players are tested every 2 days currently with the help of Vanderbilt, and then tested an additional day prior to travel. For visiting teams, there will be a dedicated hotel facility, and teams are flying in and out on the same day. So those facilities are really just for the teams to rest up prior to the game, not to stay overnight. So in the case of Nashville this week, we went to Dallas twice, flew in, rested up, played our game, and then left on the same day. And that's a protocol that will continue to follow. But high level of testing, good positive process, and working currently for us in Major League Soccer.
As for the Titans, we have constructed a testing facility on our headquarters. All players, coaches, equipment staff, everyone who works with the team is tested daily currently. As for the visiting team, the league is still working through the specific travel rules, but absolutely I expect visiting teams to be at a dedicated hotel.
Good morning. We always like people to be able to use their own grocery bags, their reusable grocery bags, but if they bring them in, they should bag them themselves. So we don't want there to be any additional spread. I am seeing that a number of states are starting to ban those, so we're going to look at that carefully and see if this is something that may be adopted here. Right now, we want to encourage people, if they are bringing their bags in, keep them with them at all times. Don't let other workers bag for them. Bag yourself.
Nancy, as of right now, the fairgrounds, which is used to provide space for our in-house residents in Nashville, will be planned to continue to do that for the foreseeable future. Thanks.
Our final question today is from Harriet Wallace at Fox 17. Harriet?
Yes, good morning. I've got a few questions. My first question is regarding Metro schools. Considering the numbers that we're seeing now, I know there was discussion about virtual only for the first month. Mayor Cooper, have there been any discussions about what we're looking at for September 1 or the first week of September? Is it looking like Metro schools might return to in-classroom or remain virtual based on the trending? Also, would like to see if there's an update on where the CARES Act money will be spent in the metro area, if there's been a decision on that. And then lastly, I know that the Metro Human Relations Commission, as well as Oversight Now, has shared some concerns about the Policing Policy Commission with regards to criticism that it's simply duplicating efforts, doing studies that have already been done, having conversations that have already been had. Mayor Cooper, I'd like to get your response to that in terms of your efforts. Thank you.
Thank you, Harriet. Mayor Cooper.
Thank you, Harriet. In terms of Metro schools, I know they are daily looking at this, and the experience of other schools, I think, is deeply informing their decision, as every day the country is looking at seeing how that is going. We hope for the best, but we have to prepare for the worst. And the challenge of doing this is a great one. And I think that's just going to be a daily progress. On the CARES Act money, the CARES Committee, I think, has another meeting this week. It's an open meeting, and I do know that they're working extremely hard with our office, trying to get very limited resources into the right hands. I think the country has every reason to be concerned at the failure of a second CARES bill being passed, put off until September. What is in it makes it hard for everybody to plan. And then finally, your question about duplication between the Policing Commission and the COB. COB and the Policing Commission work. One is temporary, the commission. The COB is certainly permanent. The COB is a permanent addition to really being able to investigate misuse of force. The Policing Commission is a platform for envisioning how public safety can be enacted in the U.S. and in our city, and is going to be a blueprint for our new chief, whoever he or she is, in terms of what community expectations are in the leadership of the department going ahead. Well, the COB, I think, is going to be part of this work, and an invaluable part of this work, as it's an ongoing enforcement, independent enforcement group with investigation, making sure that we're living up to the policies that we have on the books. The other is, what are the policies that we need to have success in public safety going forward? The temporary work of this large group, I think, needs to be closely tracked by the community, and it will be. Obviously, the department faces a lot of challenges now, and again, there's a lot of great people, and I'm grateful to each and every one of them for their sacrifice and volunteering to help Nashville become the place that we want it to be, which is really the most successful city in the country in the 21st century.
Those are all the questions we have this morning. I'd like to thank Mr. Ian Ayre, Mr. Burke Nihill, and Senator Bill Frist for joining us this morning. The next scheduled Metro COVID-19 press briefing will air on Thursday, August 20th at 9:30 a.m. Thank you for joining us. This concludes today's briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.